My name is Monica. Today I'm going to discuss about the unit 6 journal assignment. Before I start, I want to discuss a little bit about the therapeutic use of self. Therapeutic use of self refer to the therapist's intention and the conscious use of their personality, insight, preconception, judgment as a part of the therapeutic process to facilitate client progress and build a strong therapeutic relationship. Some details about it, if I have to discuss some detail about it, it's about understanding and utilizing therapist's own characteristics and experience to create a positive and an effective therapeutic environment. The key component we use on the therapeutic use of self is empathy, authenticity, self-awareness, interpersonal skill. Importance of a therapeutic use of self is therapeutic alliance, client engagement, facilitating change. Some of the example is using empathy to understand client struggle, being authentic and genuine to interactions, reflecting on one's own feeling and reaction to the client's story. Therapeutic alignment of self means a strong therapeutic relationship and critical for the successful therapy outcome. So back to the journal assignment itself. The journal assignment 6 mentioned in some of the key point I need to mention. Describe a significant event patient interaction you have experienced. So I want to mention, I have multiple interaction. I want to mention the interaction that I have recently, a couple of weeks ago, in regard of diagnosing and treating the person with alcohol abuse disorder. On that interaction, I have a counseling session with my patient, and I use my therapeutic self to discuss about the further treatment modality and understand the patient point of view. On this, discuss the impact this had on you in terms of increasing your understanding of PHNP role, psychotherapy, and provider-patient relationship. So this interaction gave me an insight of patient, where he's coming from, what are the causes, what is his worldview. I get to know all the information by using my therapeutic self, by being authentic, genuine, and very mindful, being empathetic, authentic, and self-aware, and being therapeutically aligned, client engagement, and facilitating change. I use my empathetic self, and I also use my reflecting and insightful judgment to have a better interaction and being fruitful to my patients for the modality of changes we need for the treatment. Discuss the impact this had on you in terms of increasing your understanding of PHNP role, psychotherapy, provider-patient relationship. Yeah, it have a significant role because it gave me insight, as I mentioned before, and it also helped me to be grounded and to be a better provider. Explore your personal strength and limitation and their effect on the provider-patient relationship. Okay, in this strength, I think I have a strength of I'm insightful, I'm very patient-centered, I'm authentic. Some of the part, I think my limitation is sometimes I conflict with my ethical self, and I kind of become little judgmental. Sometimes that is my limitation, and I'm still working on that. And explore your personal strength. My strength specifically, I would say I'm very genuine and I'm very authentic. I represent who I am, my authentic self. Explore personal include reflection on your therapeutic use of self. Yeah, as I mentioned earlier, I'm gonna repeat again. I use myself as a empathetic person, as an authentic person, and I'm self-aware, and I use my interpersonal skill and empathy to have a better client-patient interaction. Your discussion should reflect your specific learning insight. Identify this. Okay, my specific learning insight I should say is like it gave me a broad spectrum of how using a therapeutic self can enhance the patient and the client and therapist or provider relationship, and how it can be very fruitful and very empowering in both the team. Identify something specific that you learn from the reflection on the event interaction, and how will you apply that learning in your future practice. um, yeah, that interaction gave me insight of what could be a hindering factor, what are the strength or what are the outcome we can gain as a provider. And it also gave me a knowledge of self-awareness, self-alignment, and being empathetic. And I'm gonna carry that experience with me, and I'm gonna apply in upcoming therapy, upcoming treatment modalities. So overall, it was a great experience. Having that said, it is very eye-opening and very mindful, which empower me as a provider, which increase my self-motivation, which increase my strength, and overall, it increase quality and experience as a provider overall. Using a therapeutic self is amazing, and then it's gonna probably gonna empower me in upcoming various days. Thank you for your time. You have a blessed day. Bye bye.